My name is Tim Sawyer, and we have with us tonight Dr. Robert Marshall, who needs no introduction. He is absolutely the original gangster of men's sexual health. He's the one and only. Just little history about myself. Prior to joining Trumalemedical as the business director in April of 2023, so coming up on a year, I was an entrepreneur and sold digital marketing and software solutions. And in the last iteration, we sold to elective medical folks. So folks who were men's sexual health experts, plastic surgeons, cosmetic dermatologists, med spas. And I spent a lot of time in the industry and got to know a lot of really wonderful people. And through that, got to meet Dr. Marshall and Christina Imes, our practice manager. Hopefully some of you have gotten to meet her. So super excited to be here tonight. Really grateful that all of you guys joined. And so what we're going to talk about tonight, kind of as we discussed in the text promo and online, is we want to start with the aging process. What does the aging process look like? And what is the effect of the natural aging process on sexual function and other important parts or functions in the body? And Dr. Marshall's an expert on that. I certainly don't profess to be a medical doctor. He's going to give us all the information we need around that. So we want to talk about the aging process. And then we want to talk about what can we do to prevent that from happening, slow that down, or in the event that it has happened and some things have gone wrong, what we can do to reverse the effects. And then we want to get into some of the treatments that we provide in the clinic to do just that. And then we want to talk about REGENmax. REGENmax is a revolutionary, groundbreaking treatment for sexual performance. It's the ultimate solution. It is the only globally patented solution for the reversal of erectile dysfunction, to actually cure erectile dysfunction in a clinical trial of more than 250 men. And we're super excited to talk about that. So the other thing I want to talk about, in addition to being the business director, I'm also a patient, a client. And I had a great experience in the clinic about a month or so ago. Went in, visited with Dr. Marshall and our nurse practitioner, some of you who have met Kelly. And I did actually went in the treatment room and did all the treatments that we're going to talk about tonight and videoed them. And the way we did it was, hey, this is the treatment I'm doing. And then Dr. Marshall commented on the medical benefits that you can expect associated with each one of those treatments. Those will start there's 12 videos. It's a series. Those will start to be released tonight on Instagram. You can follow us on Instagram at Trumalemedical or at Trumalemedical. You're going to love it. So having said all that, I want to give Dr. Marshall a chance to introduce himself, talk a little bit about Tru-Male, and we'll go from there, Dr. Marshall.
Thanks, Tim. Welcome to the podcast. This is very exciting for me. It's what I really live for, and that's helping men live better and live longer. Why do we get older? Well, time takes place, and all our genes protect us until we get past the age of reproduction. After that point, the genes aren't really going to protect you. Nothing in them is designed to help you after that age. So about the age of 40 or 50, things start to fall apart. It's the second law of thermodynamics called entropy. Nature wants to have you fall apart. You're redundant. You've made your kids. Now get out of here. Now you can listen to Mother Nature and do that. And if you want to go down that rabbit hole, it's not a pretty trip, but there's a second alternative. You can be proactive and make changes in your lifestyle, make changes in your activities, make changes in your practice of improving yourself. So the first thing you have to do is accept the fact that you can't just let nature take its course. So you got to do some things. And that's great because you guys are here for the purpose of maybe making some changes. Nature gave you erectile dysfunction. It happened over time. It wasn't something that happened suddenly. And it happened because your nature wants to tear you apart. So we're going to show you a method that has been developed called REGENmax. It's going to change all that. And it's going to help you turn back the clock and start at a younger age as far as your penis is concerned and your sex life is concerned.
And Dr. Marshall, that's a great point. Um, in starting the conversation around sexual dysfunction, talk a little bit about, as you can see here, some of the symptoms that we all, guys, who on this webinar hasn't dealt with some of this stuff, right? So when do those, how do you notice when those symptoms start to manifest? And then also, what's the relationship between obviously the person you're with, the physical components of it, talking about aging, and psychological as well?
Yeah, so the sexual dysfunction has got a lot of different aspects to it. But overall, it means that the sexual activity that you want to participate in, either you can't do it or you don't feel up to it. In either case, it's very disconcerting to the relationship. The idea of intimacy is a big part of life. It confirms who you are, it confirms who your partner is, and it creates a strong bond between the two of you that'll create empathy and trust and love. So it's really a wonderful thing. But when the mechanics of it go down south and you can't get it up, or you can't get interested in sex, or you can't finish the act, or you can't maintain an erection for any length of time, that can really take the steam out of what should be a very rewarding activity. Now, it's not unusual. Better part of half of all males after the age of 55 experience sexual dysfunction of one form or another. Erectile dysfunction means that you can't get an erection. Lack of interest is like lack of libido. You no longer have the drive or the interest to participate. You kind of put it off. You might be had some episodes where you didn't have the ability to get an erection, or you didn't have the ability to perform, and that's in the back of your mind. And every time that you think about having relations, your anxiety kicks in and you become anxious. And I guarantee you, if you are worried about getting an erection, you won't. It's impossible. All your blood is going to go to your heart, your eyes, your brain, and your muscles. Nothing's going to go to your gut, and nothing's going to go to your penis. So if you are anxious, forget about it. So we need to get you in a position where you feel confident and you don't worry about a couple episodes of dysfunction.
And what, let me ask you this, Dr. Marshall.
Yes.
Something I heard another doctor talking about once, where people think, the average lay person like me thinks, oh, I've got to get hyper excited. And he was talking about, it's actually the opposite. The more relaxed we are,
yes,
the more likely we are to become, I don't want to say aroused, but be able to do what we need to do, right?
It's evolutionary. Think about the caveman out there chasing an antelope or being chased by a tiger. He's in something called the sympathetic mode. It's part of your autonomic, below your brain nervous system, and it's automatic. So when you are in the sympathetic mode, nothing's going to go to your penis and nothing's going to go to your gut. And that being the case, you don't want to get an erection at that point because it's not going to be useful. So Mother Nature helped him, get away from the tiger or catch the antelope. That's a good thing. And that's how your genes got passed on to you at this point. But when he got back to the cave with his antelope, his partner would cook it up and he'd relax and he'd become parasympathetic. And now the blood can go to the penis and the gut. So he can eat and he can have sex. And both are by design, so that's the time to be able to do those things.
That makes sense.
Yeah,
it seems counterintuitive, right, in a way.
Right. So in the back in the day, it helped us survive. That's how come we're here, because our genes were passed on. But now, this sympathetic mode only gives us road rage, anxiety, and erectile dysfunction. Not what was designed for. Unfortunately, we evolved very slowly, so we're going to have these issues for many, many years.
Yeah. That makes sense. And then as we talk about how we age, right? What starts to happen is hormones drop, right? So talk about that process and then kind of the cascading effect once that kicks in.
So again, Mother Nature wants you to make babies. Once that's over with, Mother Nature's design is not really going to help you maintain your libido or maintain your physique, maintain your health. So, the male sex hormone is testosterone. And testosterone is very important to our feelings of self-worth, feelings of confidence, our feelings of sexual ability, our feelings of being physically fit. It's vital to your well-being. Unfortunately, your testosterone peaks at the age of 20, and then it goes down 1 to 2% a year every year thereafter. So if you're at a high testosterone level when you're 20, 40 years later, that's about 70% down from where it was before. So you have a small fraction of the testosterone you had before. Now, the result of that is you lose muscle mass, you gain muscle fat, you lose libido, you lose erections, you lose confidence. These are all signs of aging and also signs of testosterone or deficiency. Now, we can test for your testosterone level and see what it is. But really what the important thing that we worry about is, what are your symptoms? How is this lack of testosterone affecting you personally?
Right. And when we've spent time together, you're super physically fit for at a young age. Um, when did it occur to you that, hey, I've got to get ahead of this? And what was your anti-aging regimen?
So I studied under Andy Weil, who was a Harvard guru who went to the University of Arizona and created a fellowship program, and it was all about holistic health, how to do things holistically, not necessarily saying modern medicine is bad, but modern medicine is insufficient. It's really naive in many respects, and so that got me to thinking about what it is that constitutes aging and what it is that keeps you young. When I first went to medical school, my passion was the difference between pathological and physiological aging. How much of aging is disease and how much of aging is just natural? And it turns out that most of aging is a disease. You could say it's natural because that's what's going to happen if you don't make some changes. But if you are able and willing to do some things, exercise, diet, hormone replacement, being physically fit and being mentally fit, you're going to go down the tube. So you have to be proactive. And it's not that hard to do. It's just hard to start.
Yeah. And stay with it.
Stay with it. Yes.
And by the way, I want to take just this one because we're going to be so for those of you joining us tonight, we've actually started a podcast called Better Mojo, Better Life. The co-host is the CEO of Peloton. Peloton provides the pellets that we use for testosterone or bioidentical hormone replacement therapy. And we'll be interviewing Dr. Marshall and Christina next week. There are some episodes that are out, but you can get it on Spotify. And we're talking about all these issues, guys, on that podcast. It's called Better Mojo, Better Life. Go to Spotify, or you can grab it on our website. Just look at podcast, click on the link, and you can listen to these episodes. You're going to love it. And it's right in line with what Dr. Marshall is talking about tonight. And so watch for that episode coming up. Go ahead, Dr. Marshall. I'm sorry.
So basically, it's up to you. And there's no correct answer. If you want to get older and you want to let nature take its course, that's a legitimate point of view. It's not my point of view. But it is, it's a free country. Do what you need to do and what you want to do. But if you want to stay younger, if you want to live longer, you want to live better, then you need to do some things, and you have to be honest about it. You have to put in the work. You have to put in the time. You have to educate yourself on what is needed, and then you have to motivate yourself to make it happen.
And to that point, and we're only going to take a quick toe dip, guys, into the science. We don't want to bore everyone, but we absolutely want to make sure you understand that what we do is based in science, just like going to, or I should say, unlike at some level sometimes, but just like going to the urologist, everything we do is based in science. So, Dr. Marshall, if you could just take a minute and kind of explain the role that all this scientific information has in leading to some of the symptoms that we're all experiencing as we get older.
Okay, so you can develop arthritis, for example. Arthritis is a deterioration of the joints. Arthritis is debilitating, can cause you to not be able to move and do things you like to do. You could develop dementia or mild cognitive impairment, and this can drastically affect your life, your health, and your relationships, even your work ability. You could end up in relationship issues based upon lack of self-esteem, inability to be intimate with your partner, inability to empathize with your partner. These are things that you have to work on, and you can't just ignore. You can't just say, well, that's the way it is. It's a choice. You can decide that I'm going to live the best life I can, or you're going to accept the life that is basically going to happen if you do nothing. And I think the choice is pretty obvious if you think about it.
I get it. And also, we're going to talk about, and I think the best example of this, Dr. Marshall actually has a really cool anecdote he's going to share with you about what happens to collagen as we get older. And why don't, for the folks joining us, why don't we talk a little bit about what that process looks like?
Okay, so collagen is a connective tissue. It's in your face. It's in your muscles. It's in your bones. It's in your penis. And collagen is a substance that, like any other substance, deteriorates over time. Now, in the penis, the collagen is in something called the corpus cavernosum. It's the majority of the penis body. It looks like a sponge made up of collagen. And when you're young, it's a brand new sponge. So if you take a new sponge that you purchased in the hardware store and you throw it in a bucket of water, it soaks up the water, no problem. And you can use it as a sponge, and it's great. And you use it once a week, once a month. After a year, you take that same sponge, you throw it on the bucket of water, it floats. It doesn't soak up any water. It's lost its absorbency. It's an old sponge. You have to stick it under the water and squeeze, squeeze, squeeze to get the water into it. Well, once your penis gets older, it has an old sponge in it. And the only way that you're going to get that sponge to work right is to make that sponge better. And the only way that we know how to make that sponge better is with both Gainswave and the laser treatments. The laser treatments and the Gainswave do micro damage to the collagen. And that micro damage challenges the body to repair it. So the body sends in repair cells, and those repair cells give you a new sponge over time. And then you've got a penis that's like a 20-year-old penis as far as the sponge is concerned. And that's important.
Right. And it's the combination, right? The ability to push blood. And we're going to
Yes.
talk about blood flow, right? So it's pushing blood into the penis, guys, as Dr. Marshall has explained it to me. And then once the blood gets there, you got to be able to hold it, right? And if you can't hold it, then you get the venous leak. And then that's what starts the cycle, right? And then
Well,
it's
picture,
like, oh,
picture
man.
this sponge that expands, and it blocks off all the draining veins for the penis. So the blood is stuck in the penis, which is where you want it right now because you're going to be having intercourse. So the sponge is full, the penis holds the blood, you go to work with your penis, and when you're done, it slowly relaxes and the blood rushes out and the penis relaxes. It's a beautiful design when it works.
Yeah. And we'll get it working for everybody.
That's what we do.
No problem. And this is what it looks like, right? So in other words, when you've got no blood flow.
Yes. You see the one on the left, that's a flaccid penis, and that's totally healthy because it's flaccid. That's what you want it to be. But when you become aroused and the blood starts flowing in, well, then the sponge starts filling up. And if you got a good sponge, it's going to fill up like you see on the right, and the veins are going to be squished so that they can't drain the penis, and you're in business.
And that's how the process works.
Simple as that.
And as you can see here, impaired blood flow, that's the problem, right?
Well, that's a vascular disease. Vascular disease includes things like peripheral vascular disease, stroke symptoms, heart issues of heart attacks, things like that. It's because the blood vessels that supply the blood, the arteries, become narrower because of like a rusting that takes place. It's called plaques. And once you're maybe at the age of 10, you start developing fatty streaks that turn into plaques. So it doesn't matter which part of the world you're from, everyone gets some. In the Western world, we get a lot of them because our diet is not the best. And as a result, these plaques start to slow down the flow of blood into vessels. And the first vessels that become symptomatic in men are usually the penis, because they're not as big as the coronary, the heart vessels, or the vessels going into your brain, or the vessels going down your leg. They're smaller because they're in the penis. So once they become not as good at bringing blood in, you start developing erectile dysfunction. It takes you longer and more stimulation to get an erection because the blood's not flowing in. Now, that can be a sign and a warning that you might be at risk for heart disease. You might be at risk for stroke in the future. So it's like the canary in the mine. It's telling you that you got a vascular problem, and we need to address that. Now, in the body, you could do all kinds of things: stop smoking, reduce your cholesterol, exercise, things like that to help improve that situation. In the penis, fortunately, since it's not within the body, we're able to put shock waves into it and break up those plaques.
And that's known as the gained wave
That's
therapy,
the gained
right?
wave. That's the extracorporeal.
Is it true? And I want to move on, but is it true that if you're having blood flow issues, which as it relates to sexual function, is that a precursor to possible heart issues that you have down the road? Or
yes, it is. It's absolutely a precursor. So it's a warning. It's about 10-year lag, typically, so that you develop erectile dysfunction 10 years later, you're at high risk of developing coronary artery disease and subsequent MI.
Yeah. So it's more than just a pleasure thing.
It's your body depends upon your vasculature. That's how the blood gets around your body. All the things, your lung delivers oxygen to the hemoglobin, and it delivers oxygen to your body all over the place. All your nutrition gets in the bloodstream, and it's delivered that way. All your hormones and everything else are delivered by the bloodstream. So without the bloodstream being effective, we're in trouble.
Yeah, that makes sense. Scary stuff.
Yeah, well, it's scary, but there's things we could do about it.
And here's the things we got to worry about, right? So how do we reverse it? We talked out of the gate, guys. We said we talk about aging. We talk about how things start to break down naturally, right? Naturally. And then the question is, once it happens, what can we do about it? So talk a little bit about the fact that it's literally maximizing sexual performance, guys. It's not about one thing, right, Dr. Marshall?
Right. It's multifactorial. Some people have more of one factor than the other, but if you're my age or even younger than me, it's going to be all of them to some degree. So to start with, let's talk about hormones. You are a male that depends upon testosterone to be a male. Without testosterone, you're not a male. Your characteristics change because you don't have the testosterone maintaining, your muscle mass, maintaining your confidence, maintaining your sexual function. So we don't care what the number is. If it's really low, then we're going to be more aggressive. But no matter what the number is, if your symptoms show that you have low T, we're going to replace testosterone and put you in a place where you no longer have low T. You're able to perform all these functions I just described. So testosterone is a very important part of that. Sometimes, we can try gains wave without testosterone, and it just doesn't work for some people because they really need the testosterone boost. So
Yeah.
this is something that we always address. The next thing is, we need to make the penis young again. And we can do this through both the Gaines wave, breaking up fibrosis, and through the laser, which puts the sponge back in its youthful vigor and its absorbency. So that's the regeneration part, so that the penis is able to work properly. And of course, we need to improve the blood flow into the penis. And one of the first symptoms we see is a result of blood flow, poor blood flow. And as a result, the penis isn't as hard, as long, as large in diameter as it was before. And it's not as spontaneous. It takes a lot more effort to get an erection. Some guys use performance-enhancing drugs like phosphodiesterase inhibitors like Viagra or Cialis, and they work, but they're temporary. They don't work forever, and it's a law of diminishing returns. They don't fix the problem, they just mask the problem. So in order to fix the problem, we need to get the blood flow flowing without a drug help. They still work for some people, and sometimes it's necessary for you. And then finally, TRF is a exosome stem cell product, amniotic fluid in origin, and it basically is a way of turning the clock back on your penis about 10 years. It's like you get a younger penis because it sends in all these messenger cells called cytokines out to your body, and they bring in all the repair cells, and they look around, and you got fibroblasts, myoblasts, angioblasts, and they say, we need some work here. This penis looks like it needs some help. So they just fix it up. So the reason that works is because the body can't have repair cells everywhere. Right. So they have enough that's kind of on standby, just floating around in the circulation. But when this stem cells send out messengers, they all congregate in the penis, and they're all good. And that's when the good stuff happens.
And using stem cells for regenerative tissue is not new, right? I mean, people look at pro athletes and guys, any orthopedic now, right? You go to me, goes, hey, you've got a couple things. One, we can, do laparoscopy. Two, maybe we can drop some stem. Isn't that right?
Absolutely. It's used in dentistry, for example. If you get an extraction, you don't have enough bone in your jaw there, they'll put stem cells there to stimulate bone growth. If you have a bad knee and you've got some collagen that's like your meniscus, for example, is worn, there's two options. One is to go in there and do a repair surgically. One is to do PRP or stem cells, intrajoint, and the third is to do both of those things. And both of those things is usually the best approach.
Got it. And that's why we do multimodality.
That's right.
And so now what we want to talk about, the one, the only, guys, this is really cool. And I'll let Dr. Marshall introduce it and tell you why he decided to bring it into the clinic in Tru-Male and the results that he's seeing there.
This is extremely exciting. I've been in this business for a long time, and Gaines wave was an extracorporeal percussion was a big breakthrough, but it only provided about at best 75% success rate. That's still pretty good for medicine, yep. But it's what it is. But REGENmax, developed in Texas, is a patented process that uses both the Gaines wave and the laser treatment and the testosterone replacement and the exosomes. And the result is they tested 250 people, and 242 of them got rid of their erectile dysfunction. That is amazing. It's totally amazing. I mean, that's unheard of in medicine. So that's a 97.2% effectiveness rate. And it's long lasting. So the investment needed to do this is significant in both time, in both money, and in personnel. So you have to ramp up to be able to do this process. It's not just a simple process. And so, we've had to train our people in Texas and here. We've had to purchase equipment compatible with this REGENmax program. And the results have been amazing. We've had so many men that we've changed their lives and we've for the better. And they're so grateful and we're so happy because we are invested in their success. And without their success, we're wasting our time. That's all we're here for, is to make them healthier.
And I think we it's interesting, guys, because we send out every time someone comes in for a treatment, we send a question and say, hey, how was your treatment? And the responses have been great. And it's a testament. I say this all the time. It's a testament to Dr. Marshall's leadership and his foresight to say, hey, this is where we want to be, and to be able to say, hey, in medicine, 75% is great, but if there is something proven in clinical trials that's significantly better, then he told me, hey, you got to go bring this in, and we got to make this happen.
Absolutely.
And
And
so
we've been fortunate. We've brought in some mid-levels practitioners who perform many of the treatments, and they are well versed in these treatments now. They're very motivated about performing these treatments, and they are very good counselors walking you through what you're going through to help you get to where you want to be, because we all want you to get there.
yeah, and so let's take a minute just to walk through the elements of it, guys. And this hopefully will make sense to you. And I do want to say, um, everything on this webinar is anonymous. So if you have a question about anything that we're talking about or anything related to what we're talking about, we are monitoring questions. We will take questions, and we'll stay as long as we need to answer any questions that you have as we go through this. And we encourage you, like I said, it's not, I have no idea who's asking any questions, but please feel free to do that. So, okay, let's go. So shockwave therapy sounds crazy, but
So what it is a machine that has a bullet that goes back and forth inside a cylinder, striking a stainless steel plate at the end of the cylinder, which is placed against the penis, which sends a shockwave, non-focal shockwave, into the penis. That's the Gaines wave of a shockwave. And the result is that the fibrosis in the penis, because the penis hasn't been getting as large as it was before, is starting to be broken up. And so the penis's ability to expand to its original size. Second thing is it breaks up some of the plaques in the vessels over time. And so the vessels can now deliver the blood necessary for the penis to do that.
exactly. And like, as we mentioned, guys, this is one of the four pillars in the beauty of REGENmax is the multimodality approach, right? And then the laser, and I want to say, because I went and did this under Dr. Marshall's guidance. Like I said, I did all these treatments and was grateful to do it, and loved the P shot and all that. This is revolutionary because the inventor of REGENmax, who is a good friend of Dr. Marshall's, a friend of ours, was the first guy on the planet that figured out the key to reversing ED was this laser. So talk about that, Dr. Marshall.
Yeah, so as I mentioned, there was not much treatment for this in the distant past. I mean, people would get implants in their penis. People would get injections into their penis of trimix, things like that. That was the urologist approach to erectile dysfunction. And, it was a solution, but it wasn't a happy solution. It wasn't a spontaneous solution, and it wasn't, enjoyable solution. Then came along Gaines wave, and it was a major breakthrough in getting us better results, and we were able to actually help men to use this technique so that, in conjunction with the penis pump, while they were getting it, so that they could develop a penis that now has good blood flow. Yeah. But the problem with that was that even though the blood flowed in, if the sponge wasn't well taken care of, it was just going to flow in and flow out. And so the blood wouldn't necessarily stay in there. So guys would have to put a cock ring on or something like that to maintain that erection. So this laser treatment fixes that sponge. It gives you a brand new sponge. And that brand new sponge is what is the missing piece in the past as far as how to make this happen. This is the main new ingredient that changes everything. because now not only can you get an erection, but you can maintain that erection. And you don't have to think about it. You don't have to worry about it. It just does. It just happens. When we start treating guys, and after about 3 or 4 sessions, they start getting morning wood like they used to when they were young. It's
Yep.
eye-opening and it's
Yeah.
confidence building. And it basically takes away all the concern about how is this going to work? It's working already. And why was that? Because you were relaxed and it worked. So now all you got to do is relax and you'll be good to go. So and then finally we use the exosome shot to take the whole penis and make it younger again, so that it has all the connective tissue, all the vessels, all the nerves, everything that you need that was there in the first place. The exosomes bring in those repair cells and they fix that like it used to be.
And then the building block.
Yes. So the hormone replacement therapy. This is the testosterone, and the traditional way of doing testosterone was with injections or with cream, and they worked sort of, and they were a roller coaster because each time you injected it, the testosterone would go up and then it would go back down over a week period. So you're on a roller coaster ride. Or you could use the cream, but that was not as effective, and there was the danger of transferring the testosterone to your partner or children, and they grow beards. Now, so you don't want that either. So what we do is the pellets, and these are tiny little grains that we put under your skin on your buttocks, and they stay there for 4 months. So you got a steady testosterone for 4 months that basically helps you make the total program work and keeps you both libido wise, sexual function wise, masculinity wise. It makes it all happen for you. Now, the emotional and relationship aspect of this is immense. Your confidence is so sexy. Women love guys that are confident. They want arrogant guys, but they want guys that are confident. And your confidence makes everything better. So that's why we do it.
Yeah, and I think that's, you can't overstate that, right? And so when things start to go wrong, you have a bad experience, 1 or 2 bad experiences, and then you get an erection goes down, and then it starts this cycle in the brain. And so what we aim to do in the clinic at Tru-Male is give you that confidence back. And once you get your confidence back, it's the anxiety around, is this going to work? Like Dr. Marshall stated in the beginning, if you're anxious about whether or not you're going to be able to perform, it's going to be tough, right? We've all been there. And it's tough. And so what this does is it deals with every piece of it. And we joke because it's relational, it's physical, it's psychological. We can help with the psychological and the relational, and maybe we get you a coupon code for a dating app and you can find someone. Seems like there's no shortage of places to find ready, willing, and able partners that you're simpatico with. So we'll help with that too, right?
Yes,
And
yes.
at the end of the day, guys, this is the point, right? And I'm the business guy, so I'll let Dr. Marshall off the hook here. It's 97.2% effective. It works. That's the reality. It's in a clinical trial. We're friendly with Jeff Newsiard, PhD, who is the inventor and the founder of the REGENmax protocol. He was awarded the only global patent, you can look it up, the only global patent for the reversal of ED in a clinical trial. So, it's funny. People say to me, well, it's an investment in time, right? You got to come into the clinic and you got to stick to it and be compliant and all that. And they say, oh, I feel like that's a little bit of work. And I say, if you had a partner who was ready, willing, and able, and you couldn't be with them, or at least couldn't be with them at the level that you want, with the consistency and frequency that you want, what would you do to fix that? Honestly. what would you do to fix that? Right. And so that's why Dr. Marshall and Tru-Male made the investments that we did. And that's why we believe so much in this. And one of the things I wanted to give as we wind down, guys, I want to give everybody an opportunity. There's other things that we do in the clinic, and many of you have been to the clinic. The clinic is, maybe you know or don't know, it's attached to the Oak Brook Mall, the prestigious Oak Brook Mall. Place is beautiful, by the way. Go check out the Psycho Bunny. It's one of the stores right outside the office. We're in the professional building there. It's really easy to get to. And so if you have any questions, we're here for a minute about either our bioidentical testosterone pellets, how the laser plus gains wave. We also offer the P shot. The P shot is a really cool procedure. Actually, I've done that twice, and amazing, 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 amazing. It's actually one of the videos that I shot when I was in the clinic. Great result. And or peptides that you can use that are really cool. Weight management, like I said, guys, I'm also a client. I've been on tirzepatide since October. I have lost, Dr. Marshall knows this, my team knows this. I've lost 32 pounds. My wife has lost 30 pounds. You can go on Instagram and see my actual before and after. It's really cool. So I use this stuff and I love it. I've been married 32 years, one woman. I got to find ways to keep it real. So we have a question, and do you
Yes.
take insurance? How much is REGENmax? Second question, what about men with prostate cancer? So we have a bunch of questions coming in. So,
I'll address the prostate one first.
okay,
The question was, what about men who had a prostatectomy or prostate removed, or any issues with the prostate? Well, the prostate is a sexual organ. It has seminal vesicles in it, so that when you ejaculate, the seminal vesicles give you the ejaculate that is delivered to the penis. The testicles themselves produce the sperm that joins the ejaculate, and that's what your penis ejects. So when you have a prostatectomy, you're not going to ejaculate because there is no prostate, but you can still have a orgasm, and and you can still have sexual function, even if you've had nerve damage, even if you've had vascular damage. We've had good success, and of course, every prostatectomy is going to have different results because of the surgical techniques and how much of the prostate and surrounding tissue they had to remove, and what kind of medicine they put you on afterwards because of that. All those things are factors, but overall, we've had good success with many men who have had a prostatectomy. And we have other modalities we can use, including Trimix and including Muse, that can help men achieve satisfactory sexual relations, even if they don't have a prostate. So that should not be a hindrance for you.
got it. The next, we'll click through the couple of these. So how long is the REGENmax program take? When do I see results?
Okay, so the results vary. Some guys start seeing results after their second treatment. Some guys, it takes about a half a dozen treatments. Rarely does it take up to 8 or 9 treatments before they see big, good results. So, but for the most part, it's somewhere around 4 to 5 treatments. Now, what are the results? Well, the first result you're going to see is that you get morning wood. The second result you're going to see is that with the hormones, you're going to start getting stronger libido. The third thing you're going to see is that you don't feel so anxious about being able to get an erection. And that combination is amazing. And so then depending upon the speed of your response, we either prolongate or shorten the amount of time between sessions to make sure that you get the results you need. And we are here, we're going to give you treatments until you get the results you need. So, you have to participate, you have to use your penis pump in between sessions so that it helps. It's kind of like doing push-ups without eating any protein. You're not going to get any muscle from that. So you need to do the penis pump too. So that is that works, and it's going to vary from person to person. But we will never leave anyone behind. We're the Marines, and we don't leave anybody behind, and we're going to get everyone over the finish line. And we're invested in your success, and that's why we're here.
And I also want to add to that because as someone who, as an outside observer per se, although I have had my fair share of challenges, I'm 56, like I said, been with the same person the whole time. At one point, I weighed 265 pounds, and yeah, I had some problems for sure. And so, one of the things that we want to make sure at Tru-Male is, yes, REGENmax, it's not, you don't flick a light switch. It takes a minute, right? But there are a lot of things that we offer in the clinic that are like, they don't cost $100, $150. That if you want to have, we call it, kind of funny, but it's true. If you want to have a big weekend while you're going through the process to get that long-term confidence and sustainability, we got you. We have the big weekend. We have the big week. We have cool stuff that you can do. That it's like, hey, I want to reverse what I'm dealing with, but I also want to have fun, and we can do both.
Yep.
So I want to address, let's see here, how does a P shot work? And I'm gonna let before I let Dr. Marshall answer medically, that's the one procedure that I did it twice, and watch the videos that are coming out on Instagram, and they'll be on our site as well. I videoed it live, my facial expressions. Uh, Full disclosure, guys, it's not one shot. The P shot is 5 shots, 2 in the bottom, 2 in the middle, 1 in the top. And so I did it twice without we offer numbing agents, we offer full pain blockers for sure. I did it without any of that. And Kelly, who's our nurse practitioner, or Jennifer, who's our nurse, I did it with Kelly. No pain, no problem. And I'll let Dr. Marshall speak to the science of the P shot.
So the P shot is a PRP injection in the penis. And PRP stands for platelet-rich plasma. What it is we draw your own blood, we spin it down in a centrifuge, and then we take out the platelet-rich aliquot, the part of the blood that doesn't have red blood cells, white blood cells, fiber in it. And we put this into a tube that has fibrin matrix in it. Now, this fibrin matrix is going to set up in about 15, 20 minutes after we do that. So we then inject that into the penis so that these platelets stay in the penis for a week. It's like a piece of some Jello in there that's going to have platelets. Now, what do platelets do? Well, if you cut yourself, platelets plug the hole. If they didn't, you would die. So platelets are important. But platelets also have another function. They can't stay on your cut forever. They got to let go because they're going to die. So they send out something called cytokines. And these cytokines bring all the repair cells to the area, and they fix whatever is needs to be fixed. So muscle needs fixing, they can do that. Nerve needs fixing, they can do that. Blood vessels, got you covered. So those cytokines bring in the repair cells that fix it up. So we use that fact, that natural design, and put it into a space where there's a concentration of the platelets, and all these cytokines go out, and all these repair cells come into the penis. And what do they do when they get there? They look around and say, you know what? You need some help here. We got to fix this. We got to fix that over there. They're smart in that they recognize problems in their area of expertise. And by the time that the rich plasma is gone, your penis has been rejuvenated.
So we got to keep going here. We've got a few questions. We appreciate everyone asking these amazing questions, and we're going to get to them all. I get testosterone shots. Are pellets better?
Yes. And the reason they are is two. First, testosterone injectable is not bioidentical. It's close, but it's not bioidentical. Now, we don't know what the result of that's going to be, but it's not as good as bioidentical for sure. long term, we don't know what the long term effect would be. Second thing is you're on a roller coaster. The testosterone injection, the typical male lasts about 6 to 7 days. So you get your testosterone shot, your testosterone goes up at day 2, day 3, day 4, day 5, day 6, it's going down. So you spend about 2 days where you want the testosterone to be. The rest of the time you're going up or you're going down. So it's a roller coaster. Pellets, on the other hand, are bioidentical. So they're the same testosterone that your body makes, and they're in pellets, which are wax. It's a stearic acid or cholesterol pellet, and this pellet melts over time, and it releases the testosterone that's in the pellet into the body over a 4-month period. So you have a level load of testosterone that entire time, and as a result, you don't have this up and down thing, and it's basically you become a new person. You like where you are now as opposed to where you were. You don't even realize how bad you had it before until you get this testosterone aboard. You go, man, I feel like I'm 20 years younger. I feel like I've got so much more confidence. I feel so much stronger. I sleep better. My penis is working better. It's a good thing.
And also, I do pellets myself, guys. Like I said, in addition to being, part of the team, I'm a client, and I just had pellets done. That's another one of the videos that you'll see. I know I sound like a broken record, but you'll love seeing them. It doesn't hurt, and it's to me, it's a better way to do it for sure because it's more convenient. And the other thing is, we do offer, and I'm the business guy, we do offer memberships in the clinic. So if you say, okay, I want to be part of your testosterone program, that includes labs, that includes pellets for the year. Super easy to do, and it's not expensive at all. So how long was we got some chat stuff I'm trying to get to. What is the cost and the payment options? So let me start with this. What if you have had some intermediate term TRT plus a dozen or so gains wave sessions and then a pause ever since? Would we start over? Would we start over on those along with the other steps to the program?
But how long ago? Of course, it depends on what their shim score is, how bad their erectile dysfunction is at this point, and
Okay.
where they want to go. It would also depend upon what their goals are. If they want to have full sexual function, they need the program. They need to start again, and we can tailor a program to someone if they're erectile issues are not major. They're just it's kind of going downhill. We can institute a maintenance program where they wouldn't necessarily have to come every week or every 2 weeks, but they could come once a quarter or something like that. So we'll tailor it to their situation. But being frank about what you're looking for and being honest about how it's working out so far will really help us design a program that's going to work for you particularly.
Yeah, and I'll say on the business side of that, to whoever asked that question, if you're an existing Trumalemedical or men's performance clinic, so many of you may be familiar with men's performance clinic. We have since merged with them. They've become part of the Trumalemedical team. If you've invested money in previous treatments, we'd love to talk to you about that. And obviously, we can apply some credit for that if you wanted to migrate over to a more robust treatment option. And then the other thing is, so in terms of the cost, we've got 3 or 4 folks who asked, what's the cost? REGENmax is a 1-year treatment, and it's $10,000 for a year. And then the second part of that question was, what are the payment options? So what is the cost and what are payment options? So we've got a bunch of payment options available to make it more affordable. We're partnered with Care Credit. Care Credit provides financing for this solution. We have our own internal programs that we love to talk about. If you say, hey, listen, I understand it's a 1 year treatment, and let me qualify that. 1 year treatment means for the first 2 months or so, there's a big commitment, right? You've got to come in every couple of weeks. You've got to get your laser treatments. You've got to get your focus wave treatments. Um, we'll get your pellets done initially, and then get your exosome shot squared away immediately. And then it kind of tapers off, right? But you've got to come in every 4 months. We monitor your blood. We want to make sure that we've got to keep your testosterone level optimized, right? So you're looking at every 4 months, so 3 times a year. So coming after the first 2 or 3 months, it tapers off, but you got to come in and get the pellets. So we're happy to talk about what that looks like. Um, so you get financed. You can talk to us about an internal payment plan. And everything that we do, guys, it's based on your goals and your budget. That's it. If you say, hey, I really, this is a problem, I want to solve it. I understand this is a commitment in terms of dollars and time, then we'll work with you to make that happen. And we'll also work with you, more importantly, to there's some things that we can do in the interim. Like I said, if you've got, a new partner and you say, okay, I don't want to worry about erectile dysfunction anymore. I want to do REGENmax. I want to get this solved. But I've also got something going on this weekend that I want to do. Then those solutions are a couple $100, right? $150 in the interim, right? They're not long term, but they're in the interim. And then if you say, hey, I don't necessarily need some of the components of REGENmax, and Dr. Marshall and his team will help you determine that, then we've got programs that range from a couple $1,000 to $8,000, depending upon what you want to do. So the most important thing is for us, it's communication. It's understanding what you're trying to accomplish, and then what's reasonably um, at some level affordable to you. And then we want to work with you to make that happen. And hopefully you've seen tonight by listening to Dr. Marshall that his, if as the business guy, if I let him do what he wanted, we wouldn't charge anybody anything. That would be the price. It would all be free. But unfortunately, the laser that we use, he wouldn't tell you, but that's a $250,000 investment. The other technology and the devices that we use, it's hundreds of thousands of dollars. And so, and we're happy to do it. We're glad we did it, and we want to provide the best solution for you, your partner, that we possibly can. So I hope that helps. Let me make sure. How long is REGENmax? What's associated? What's your Instagram? Our Instagram is at Trumalemedical. And you'll start to see some of those videos coming out. Like I said, they'll come out consistently. So what I was wanting to do was take you guys into the treatment room. When you talk about lasers and you talk about injections and all that stuff, 2 years ago, if I had heard that, you know, that'd be a little off for me. But having met Dr. Marshall and spent time in the clinic, and when you get to meet our team, guys, you're going to be psyched, right? When we see the text messages that we get, you can look at the reviews that we get. It's pretty cool, man. And Dr. Marshall is not, he's long past a guy who needs to make money. But we do need to pay for the stuff that we provide in the clinic. And so we try to do the best that we can to work with you and keep things affordable. So with that being said, I think we've got everybody's questions. Anybody interested in talking to Dr. Marshall one-on-one? Usually we have a small fee, $100 for a consultation. We'll waive the consultation. Just mention TMM Web. That's the Trumalemedical webinar. And we'll waive the consultation fee, and you can go spend half an hour with Dr. Marshall. Just tell him what you're trying to accomplish, how you feel. And we'll come up with something that makes sense for you. And if there's any other questions that you have, I think we got, we do not take insurance. Insurance hasn't caught up yet, guys, with what we do. Traditional medicine hasn't caught up with what we do. You're going to go see, if you go see your urologist, he's just going to tell you you're old and maybe you need a penis pump. And that's that's not where we're at. So we'd love to help you guys any way that we possibly can. We really appreciate everybody joining us tonight. If you have any questions, you can see on the screen here, just shoot an email to Danielle at Trumalemedical. She'll be more than happy to get you set up with Dr. Marshall. Uh, Dr. Marshall, I consider a friend, and if it's okay if I call you Bob,
Absolutely.
I want to say thank you so much for your time tonight. And we want to help, guys. We want to help any way we can.
Yes,
Reach out, shoot us an email. We'll work with you any way that we can. We just want to get everybody living the best version of yourself that you can possibly be.
I just want to say we get up every morning with one thought in mind, and that's to help you with your erectile dysfunction. That's what we're here for. That's what we do, and we are invested in your success.
Right. And even if it's not just to that point, Bob, even if it's not just erectile dysfunction, guys, you want to optimize your hormones, you're a biohacker, you want to have the great, for whatever reason, you want to just be better, you want to have the greatest sex of your life.
We do
no
that.
problem. We do that too.
Yep.
So I want to thank everybody for coming. If there's no other questions, it looks like we're good. We will record this, guys. We have recorded this, and we'll get it to a place where if you want to share it with a friend, we're happy to do that. Just shoot us an email or text Danielle. Go to the website. Remember, it's the podcast that you'll be seeing Dr. Marshall and Christina on very shortly is Better Mojo, Better Life. Our first two guests on that podcast that you can download now are Dulvet Quince, who was the celebrity trainer on The Biggest Loser. And then we also interviewed the inventor of REGENmax, Jeff Nuziard, PhD, and he'll share his thinking behind the 15 years of research that he put into that and how he arrived at the protocol. It was a brave journey, for sure. So, Dr. Marshall, any last thoughts?
No, we're here for you. We look forward to seeing you.
All right, guys, have a wonderful night. We appreciate it. Thank you.